स्क्रीन दिसती का रे?
Yes, ma'am.
Yes, ma'am.
Okay.
Yes, ma'am.
Yes, ma'am.
Okay, okay. Now today we will going to see the inflammation. Okay. Audio is clear?
Yes, ma'am.
Okay. Inflammation means what? What do you mean by inflammation?
Swelling.
Yes, swelling, redness. That is the protective sign that is showing by the body. Are you getting? That is the protective sign or response showing by the body, human body, for the etiological agent. It may be infectious or it may be non-infectious. Okay. One thing. Wait. Now sharing, is it there?
No, ma'am.
Okay, let it be. 1 minute. Just listen first. Okay. Audible now?
Yes, ma'am.
Yes, ma'am.
Okay.
Yes, ma'am.
Just first listen, then I will share the screen. Otherwise, you will get disturbed. Okay. Inflammation means what? That is the protective response by the body to variety of the etiological agent. It is the body defense reaction. It is the body defense reaction. Means it is the body defense reaction means what? Now one thing, you listen this one. In our boundary, so many soldiers are there, isn't it? If the foreigners or if the other one, the enemies will they attack, then our military should be strong. If it is not strong, they will show their action, isn't it? That action we called as these all type of actions are there. The etiological agents are there. Too many etiological agents are there. Infective agents like bacteria, viruses, toxins, fungi. Okay. Immunological agents are there. Means antigen antibody reactions are there. Physical agents are there. These are the positive agents. Physical agents means what? Heat, cold, radiations. Okay. Chemical agents are also there, organic, inorganic, poisons. These are the etiology. Now, signs, what type of signs are there? Just now, one student, they told that one swelling is there, isn't it? That is also correct. Redness is there. We feel heat, little warm, isn't it? That is also the one of the sign. Pain is there. Loss of function is there. Okay, loss of function is also there. So there are 5 cardinal signs. There are 5 signs of the inflammation. Which are those? Redness, swelling, heat, pain, loss of function. So inflammation, it may be acute or it may be chronic. The classification inflammation, that is the acute or chronic. Now acute means what or chronic means what? Acute means just short time and chronic means long term.
Long.
Yes, very nice. So what is the difference between the infection and inflammation? Anyone?
Inflammation means enlargement of tissue, and infection means
entry of foreign substance into body.
Yes. So infection means that causative agent directly attack to the body of our human body and causes the harm to the individual. That is the infection. Inflammation means दिसतं का रे तुम्हाला का आता मी शेअरिंग करते आता झालंय का शेअरिंग
Yes, ma'am.
ओके
Yes, ma'am.
चलो नाउ वी विल से and what is the treatment of that inflammation? Anti-inflammatory agent, isn't it? What we will give if inflammation takes place? We will give the anti-inflammatory agents. Anti-inflammatory agent like the salicylates, okay? NSAID, non-steroidal, we will tell afterwards because you are now in the first year. Just 2-3 treatments you keep in your mind, okay? Don't learn too much treatment because cology, it is there for you in the second year. Then you will going to study whole there only, okay? So here we will see the inflammation. Screen is visible now, all of you? So listen here. Inflammation is defined as local response of living mammalian or human beings tissue injury due to an agent. Due to an agent means what? Due to any agent means what? Causative agent. Means local response of living mammalian tissue injury due to the agent. So here you see here. That is the inflammation is a protective response by the body to variety of the etiological agent. Are you getting all of you?
Yes,
That
ma'am.
may be
Yes, ma'am.
infectious or that may be non-infectious. It may be infectious or it may be non-infection. One good example, best example I will tell you. If the mosquito bites, what happens? Redness is there, little swelling is there, okay? Little warmness is there if the ant will bite, isn't it? So that is the body showing the response to that causative agent to be protect. That's why that is the protective response showing by the body. It may be infectious or it may be non-infectious. Sometimes it will be infectious, sometimes it will be non-infectious. If the mosquito bites, sometimes there may be infection or sometimes no infection is there, isn't it? It will go. Just the body warn us. Just the
मॅम
body
व्हॉइस ब्रेक
warn.
होतोय तुमचा
काय होतंय?
व्हॉइस ब्रेक होतोय मध्ये मध्ये
हो का? आता क्लिअर आहे? सगळ्यांना क्लिअर आहे का आवाज?
Yes,
ma'am.
ma'am.
Yes, ma'am.
ओके, तुझ्याकडे रेंज जरा प्रॉब्लेम असेल, रेंजचा प्रॉब्लेम असेल, त्यामुळे तसं होत असेल. आपण ही व्हिडिओ क्लिप रेकॉर्डिंग करत आहोत, ते तुम्हाला मिळेल त्याच्यावर. कधी कधी काय ह्याच गोष्टीमुळे आपण घेतोय ना, ह्याच्यावर का घेतोय आपण? काही जणांकडे रेंजचा प्रॉब्लेम असतो म्हणून. ओके, सो it is the body defense reaction in order to eliminate or limit the spread of the injurious agent. Are you getting that one? It is shown by our body. That is the defense reaction. What we call that is the defense reaction in order to eliminate, eradicate or limit the spread of the injurious agent. It will stop the spreading of that injurious agent. Further aggressiveness, exaggeration, it will stop because it warns her, body warns her, giving warming, isn't it? So that we will take care of that one due to that warning, followed by removal of the necrosized cells. Necrosed cells means whatever made the cells damaged, that will be removed by the body. So this is the body defense reaction. Keep in your mind. Now see the etiology. Various etiological agents are there. Infective agents like bacteria, viruses, and their toxins, fungi, parasites. So many infective agents are there. Second one, immunological agents like cell-mediated and antigen-antibody reaction. Antigen-antibody reaction. Next etiological agent, that is the physical agent. Which one? Heat, cold, radiation, mechanical trauma, isn't it? If we burn, our body will burn us. If you will keep one iceberg also, ice cube also, then there you will see the redness. That is the sign of that inflammation, isn't it? If you will keep more time, then it is that inflammation. We called as that inflammation. It is a non-infectious. Okay, it is the non-infectious. But if the mechanical trauma is there, that may be infectious. It will further exaggerated. That may be convert into the, if you will not treat properly, it will be turned into the infectious. Okay, are you getting my point? So next one, that is the chemical agent. Chemical agents like the organic and inorganic poisons. Okay, and inert material like the foreign bodies. So inflammation is distinct from the infection. Inflammation is different from the infection. Inflammation is a protective response by the body to variety of the etiological agent, that is the infectious or non-infection. But what do you mean by कौन बोलते हैं? Please mute yourself. All of you mute yourself. While the infection is it is the invasion into the body by harmful microbes and their resultant ill effect by the toxins. Infection means what? The harmful agents, it will invade to that individual and the individual will feel sick. That is the infection. Direct attack of the agent, causative agent, so that it is harmful. It is harmful. But inflammation, either infectious or non-infectious. Inflammation involves two basic processes. We will see here. It is two basic processes with some overlapping, that is the early inflammatory response and later it is followed by healing. First, it will shows the early inflammatory response. If the mosquito bites, it shows the inflammation. But after 5 minutes, it will get relapse. It will get cured. It will get healed. So followed by healing. That is the body mechanism, body defense mechanism. Due to that, it will heal, isn't it? Now see the signs of the inflammation. Cardinal, it is called as cardinal signs of the inflammation. These 5 inflammation signs are very important, cardinal signs. Which are those? Redness, swelling, heat, pain, and functio lassa. That is the Latin term. So you keep in your mind, they may be asked you in the exam. That is called as rubor, tumor, calor, dalor, and functia lassa. Okay. Rubor means redness. Tumor means swelling. Calor means heat. Dolor means pain. You keep in your mind. We will see. There are 5 cardinal signs of inflammation. 5 cardinal signs of inflammation. Which are those? Rubor means what? The redness that occurs as a result of increased blood flow to the inflamed area. Due to that agent, causative agent, the blood circulates fastly, so that there is a increased blood flow to the inflamed area. So that's why there is a redness. That area will see red. Now tumor means what? Here swelling. Tumor means what? Here swelling. Okay, swelling of the inflamed area as a result of increased capillary permeability and fluid accumulation. What will happen due to that? Why the swelling is occur? Increased permeability of that capillary permeability. तिथून काय होणार आहे तुमचं ब्लड सर्क्युलेशन जास्त येणार. It will increase the permeability of the blood. So the saturation is there. Okay. So there is a swelling. Next one, calor, increased temperature. You see there, the inflamed area we will feel slight hot, slight warm. That is the calor, the increase in the temperature. Okay, that occurs in the inflamed area as a result of increased blood flow. Why there is heat, we will feel little warm? Because of the increased blood flow. Because of the increased blood flow. Okay. You feel that one whenever you will have that inflammation, any type of inflammation, that area will become red, that area will become swallowing, and afterwards it will feel, if you will feel, then you will feel little warmness. And Calor means what? Pain. Due to that causative agent, due to that swelling, you will feel pain. Pain that occurs in the inflamed area as a result of stimulation of the sensory neurons. Why there is pain? Because of the sensory neurons, isn't it? Then loss of function. Sometimes there may be loss of function. हँग होतं पहा, बरोबर आहे. सेन्सेशन जातात, कधी कधी फंक्शन्स लॉस होतात. ओके. Now we will see, understood this one, 5 cardinal signs. You keep in your mind. Ruber, tumor, calor, dalor, loss of function. Okay. These 5 cardinal signs you keep in your mind. They may ask you in your exam. Now see the pathogenesis of inflammation. Pathogenesis of inflammation. How the inflammation develops gradually. Pathogenesis means what? The development of the disease, gradual development of the disease. The two main stages are there, vascular and cellular. Vascular response stage and cellular response stage. Now see first the vascular response stage. Rapid vasoconstriction of the blood vessel. Vasoconstriction means what? Vasoconstriction, narrowing of the blood vessel. Narrowing of the blood vessel occurs in the injured area and is followed by rapid vasodilatation. That's why rushing of the blood in that area. What happens? So when the causative agent attacks, at that time there is a rapid vasoconstriction and immediately it is followed by rapid vasodilatation. So means what? There is a rapid flushing of the blood in that area. Okay. And increase the capillary permeability occurs in that injured area, leading to the swelling and edema. Due to that permeability of that capillary, what happens? The blood will accumulate there. The blood will accumulate there. That we called as a edema, or there is a swelling due to that accumulation, due to that increased capillary permeability. Are you getting my point, all of you?
Yes, ma'am.
Yes, ma'am.
The fluids that enter into that injured area are useful for diluting out any bacterial toxins or irritants present in the tissue. What happens? The fluid accumulates there and it will get diluted. The whatever the bacterial toxins are there, due to that vascular permeability, the toxins will get diluted, and so अरे बाप रे, लाईट गेली की रे आता. We have to close our, it will be closed. Are you getting? माझी लाईट गेली आता, बहुधा आपली मीटिंग नाही राहणार, संपेल ती मीटिंग. ओके, लेट इट बी. आर यू लिसनिंग? आवाज येतोय का?